We're here with Representative Ryan Williams, and we're going to talk about a very interesting subject. Thank you for joining us today.
My pleasure to be here. Thank you for your invitation.
So I know in the last year or so that cannabis oil has been made possible for us to test, use it for maybe some medicinal purposes. What are some of the next things that are happening to help with some of the health benefits of this use?
Right, the CBD oil, there was about 72 studies that were anecdotal, or there were small random samples of testing that was done, and particularly with children with intractable seizures across the nation and across the world. In studying or researching these, they noticed that CBD oil had some positive results as related to children with intractable seizures. Intractable seizures are defined as seizures which cannot be treated with medicine. So these were last-ditch efforts by family members and physicians in order to try to find something that works. And so the CBD oil is just that. It's an opportunity for those family members to try that. The big challenge with this bill and the development of this method of treatment is there's a perception that it's a panacea, and everything that person would take it would work. We're starting to see that it only affects or helps about 38% of children with intractable seizures, which is not near. If it's your child and they're one of the other 62%, it's not good enough for you. But the 38% that are finding some benefits from it's obviously been dramatic. What a lot of people don't realize is if you have intractable seizures as a parent and a patient, you're trying to find some medicine that works. Intractable seizures are debilitating, they're devastating, they can cause death among your loved ones. And so the problem is most of the treatments cause other problems like liver disease or blindness. I met a little girl named Chloe who's now passed away from intractable seizures, but the treatments for those seizures were about as bad as the actual disease, which sometimes is a lot the case. But the challenge, what makes CBD oil a little bit different though, is that you can drink a 55-gallon drum of it and it will not make you high at all. So it's, a lot of people don't realize that with CBD or cannabidiol oil, you remove all the THC that's in it. And so, but because the plant itself is illegal and it is a derivative from said plant, it's still illegal for a parent to have possession of it, much like they would anything else, although there's not a lot of tests for it.
Right. So hence why the push for legalizing at least some forms of it so that so the parents can have something to give their children.
There is a lot of discussion centered around what that means for Tennesseans and the Tennessee General Assembly, but I think we're a ways away from seeing anything happen in Tennessee. It's very difficult because of the federal government, the way that they are, for clinical trials to be done and the access to the products necessary in order to do those clinical trials. But I think the big decision really is at the Fed right now. If they would say that marijuana and the plants and their derivatives were a Schedule II substance instead of a Schedule I substance, that would open it up for a true random sampled large or broad stretching clinical trial, which is where we would get most of the evidence that we need in order to say, is this a good thing or is this a bad thing for not just Tennesseans but Americans. But
is there somewhere that folks can go to look up more information, get some facts about some of the things that you just talked about?
They can contact my legislative office. Actually, this is something that I've been doing a lot of research over, obviously, for the last 3 years. I had a loved one who passed away from cancer, and they were on opioids for 7.5 years, became extremely addicted to opioids, and those problems created other problems. The medicines that he was taking, much like I talked about Chloe earlier, the drugs made her go blind. And so those things. So it's interesting for me to look at this and to kind of take away my biases or my preconceived notions about the thing and just look at it for what it really is. I tell people, because of my belief system, my perception is there's a created plant and a created brain that react in positive ways, what some of the data is showing, to people who have these terminal illnesses. And so much like these parents and much like my loved one, if there were something else that we could try that would do well for our loved ones, then I think that we should think about it or talk about it or discuss it at least in open venue, just to garner wisdom at the very least. So,
Thank you for taking time out of your schedule to join us,
oh, it's my pleasure.
and we'll get back with more Discover the Upper Cumberland.